So let's just go through a standard case. So say somebody needs upper lid, lower lid, face and neck, and a little bit of fat grafting. So surgery is going to be several hours on a Thursday. Whatever operation you're going to have, it's really important that you have somebody with you to pick you up from the surgery center or my office, take you home, and be with you. This sounds very basic, but this is so important. I want you to look great, but I also want to keep you safe. So the most important thing is, if there's a problem, often you're going to have a problem shortly after the surgery. And I don't want you alone at all. If you're having upper lids done, I still want somebody there. These operations, as I said earlier, are very safe, low complication rate, but they're not zero. And if you have a problem, I don't want you to have to call me. I want the person who's taking care of you, will have my cell phone number, to call me, and then we'll deal with the problem. So that's probably the most important thing that I can mention is you have to have somebody. And now there's times when we're at different phases of life. We may be in a place where we don't have a good friend or family that can do it, but it's important that we find somebody. You may have to fly somebody in, or somebody may have to come in from out of town, because it's just that important. So after face and neck lift with four-lid blepharoplasty, fat grafting, someone's taking you home. Most likely there's going to be some icing for a few days. So we're either going to use some kind of cool compress or some equivalent thing like ice. There may be some eye drops to use. The pain tends not to be terrible with these operations. And part of the reason is that they're just intrinsically not that painful. And we're going to use medication before. So typically people will get medication before, and those medications mitigate against pain afterwards. So we know a lot about pain management, and sometimes giving somebody a pill before they have surgery can dramatically reduce the pain they have afterwards, which is very interesting. And we use that all the time in surgery. And that's one of the reasons why there's more outpatient surgery done, because we don't need to have you in the hospital to manage your pain. Having said that, you probably will have a small prescription for some narcotics. So most of these things are not that painful. So if surgery was done on Thursday, you go home with somebody, or you go to a hotel nearby, but somebody's with you. It can be a nurse, although my bias is that they're usually not necessary.